Over the years, lots of studies have proven the fact that eating high-carb diet can lead to lots of healthcare issues such as obesity, diabetes, cardiovascular disease, high cholesterol, even cancer, and of course aging. It speeds up the aging process. So therefore, we've been encouraging people to try and reduce the amount of high-carb foods in their diets. All carbohydrate containing foods have been divided into low, moderate and high glycemic index in order to be able to understand the metabolic impact of those carbohydrate foods onto blood sugar and insulin levels in humans. So therefore, a high glycemic index carbohydrate, such as for instance white flour and white bread, is very fast digested and absorbed, increasing the sugar levels in our bloodstream, leading to a spike of insulin, which in turn can cause a sudden drop to the sugar level, leading to sugar cravings, fatigue, brain fog, and all sorts of symptoms. But also high glycemic index foods in the long run, if they're eaten consistently day in, day out, they have increased, according to studies, the risk of diabetes, of obesity, cancer, and all sorts of metabolic problems. Usually high glycemic foods are very, very palatable. So, and the industry, in order to increase palatability of lots of processed foods, they tend to put in lots of sugar and that increases the high glycemic index of lots of common foods. So they're everywhere. So all snacks and delicious ones are usually high glycemic index. What we can do, in addition to trying and educating people as much as possible about the value of a low glycemic index diet in the long run for anti-aging purposes, for health prevention and prevention of cancer, which are the main goals, we can also try and use and formulate and use clever nutraceuticals. And there are lots of supplements, and I think lots of companies have tried to identify supplements to try and reduce the glycemic index of carbohydrates, and also to prevent the spikes of sugar and insulin in the bloodstream that lead on to disease. And I believe Tribitor is one of them. As a clinician, I was delighted when I came across it, and because it combines all the advantages of a very, very good carb blocker with very good palatability. It's very user-friendly, so ease of use, and all safety, and lots of robust clinical trials behind it to support its efficiency and its actions. So as a clinician, I want to be able to recommend a supplement that is well founded and well designed, and I'm very happy to recommend it to my patients. I think the most obvious clinical group is the people who are pre-diabetic, who have been diagnosed with either fasting glycemia or glucose intolerance, or even a metabolic syndrome. They are struggling. So those people are usually struggling with their weight as well, and they've got lots of ups and downs in weight management, and also lots of psychological issues, and they can even get depressed because of what is happening to them. So that is a very, very good clinical group, because they can't be dealt with medications, and all doctors, all we do with them is just monitor their blood sugars, basically waiting for them to become genuinely diabetic. So instead of just monitoring and waiting, we can be proactive and use like a good adjunct, in addition to educating them to change their lifestyles. And Tribitor can be a very, very important aid. So it can be used just twice a day, and it can help reduce the glycemic index of two main meals. Could be lunch and dinner, and also dinner is very important, and also it can help reduce their spikes of sugar and insulin. And who knows, maybe if that can help them lose weight at the same time, and this could be a huge encouragement for them and a huge motivation to try and change their lifestyle, which in the long run might also reduce the risk of developing diabetes in the long run. There are lots of different approaches to anti-aging, and we try to identify, basically anti-aging is identifying what causes the aging process. And one of the main theories that are around aging is glycation. So the combination, the reaction of sugars in the diet with our DNA, with our proteins, our different structures, including skin. But its glycation can happen in any organ of our body. So this is what is actually extremely inflammatory and pro-aging, this reaction. So by reducing the simple sugars in the diet, by having a low glycemic lifestyle, can help us slow down the aging process in our skin, but also in all the other organs, the heart, the brain. So Tribitor can do that, as the trials have very obviously proven, and it can be a huge help.